A shunt is a passageway that allows fluid to flow from one body cavity into another. A cardiac shunt is a natural shunt that allows pulmonary and systemic blood to shift into each other. A cerebral shunt is a mechanical shunt that is placed in the brain to allow excessive cerebral spinal fluid to drain into the abdominal cavity. What causes the need for a shunt? Congenital hydrocephalus, an accumulation of cerebral spinal fluid in the brain. Spina bifida, this is when the spinal canal and backbone do not close before birth. Dandy-Walker syndrome, this affects the cerebellum and the fluid-filled spaces around it. This is a picture of a child with hydrocephalus. As you can see, there's an accumulation of fluid in the brain which is causing her abnormally shaped head. This is increasing her intracranial pressure. A hydrocephalus shunt is a shunt placed in the brain to drain cerebral spinal fluid into the abdominal cavity in hopes of reducing intracranial pressure. Here is a picture of a hydrocephalus shunt.
In this picture, it shows the proximal catheter leading into the brain. There's two approaches to the placement of the proximal catheter. One is the occipital and the other is the frontal approach. These apply to the point of entry of the proximal catheter. The most important component of the shunt is the valve itself. This regulates the amount of fluid that gets drained and has a reservoir for physicians to drain fluid more rapidly if needed and allows them to extract CSF for testing. Types of shunts. There are many different types of shunts as you can see in this picture. There are two basic types of shunts, however. Fixed pressure shunts have a preset value pressure that is stable even after surgery. Programmable shunts can be set to different pressure settings using a special tool. This is an example of a programmable shunt, and this is the tool they use to reset the pressure settings. Caring for a shunt. Observation is the most important part of shunt care. If a parent observes mental changes, immediately inspect shunt for malfunctions or infection. Inspect shunt for signs of bulging or swelling by observing the proximal catheter and following the shunt track. This baby has obviously experienced swelling of the proximal catheter. Inspect shunt for infection by looking for redness near proximal catheter or the shunt path. This baby has experienced signs of infection evidenced by the redness in the back of his head.
The abdominal assessment. Due to the fact the distal catheter drains into the abdominal cavity, constipation, abdominal pain, distension, or discomfort may present. This may be indicative of future or present malfunction. If any signs of infection or malfunction present, immediately contact the primary care physician for a checkup. Have child visit optometrist every 6 months to assess change in intraocular pressure. This could indicate intracranial pressure changes. Prevention of shunt malfunction. Avoid flushing the shunt. Only a doctor or healthcare provider should make any changes to the shunt. Do not wear tight-fitting hats. This greatly reduces the pressure on the brain and the shunt itself. Avoid contact sports. Do not wear a bag or put weight on the shunt side. This may cause disturbances in drainage of the fluid. Signs of malfunction. Signs of malfunction are double vision, headache and dizziness, altered consciousness such as lethargy, unconscious, or unresponsive. Nausea and vomiting may also occur. This is due to the fact that the cerebral spinal fluid is draining into the abdominal cavity. This can also cause abdominal pain. Signs of infection. Signs of infection are redness and swelling to the shunt path or fever. What to do if signs present? If unconscious or has an altered mental status, immediately call 911. If noticing acute changes such as nausea, vomiting, fever, or pain, contact your primary care physician for any further questions.